We know that genetics plays a significant part in rheumatological diseases which cause early inflammatory arthritis. However, currently we do not use genetic data in outpatient clinics in order to help us make diagnoses. Therefore, our research question was to determine if we could harness genetic data using polygenic risk scores in order to aid diagnosis of patients in the rheumatology clinic. The Norfolk Arthritis Register contains 1,047 patients who all had early inflammatory arthritis and in whom genotyping and HLA-DRB1 typing was performed from blood tests. The G-PROB tool was previously developed in order to take genetic data and convert it into G-probabilities based on the presence of known disease-associated genetic variants. The concept essentially is that a new patient would have a genetic blood test, and then G-PROB would take this data and generate results that could be interpreted by a clinician in order to suggest which diagnoses are most likely based on the patient's genetic profile. For example, G-PROB might suggest that rheumatoid arthritis is the most likely diagnosis with a percentage of 61%, whereas psoriatic arthritis is less likely with a G-probability of 2%, based on the genetics of the patient. We tested G-PROB on the 1,047 patients from the Norfolk Arthritis Register and found that G-probabilities were well calibrated with clinician diagnosis. Furthermore, the AUC suggested that G-probabilities had good discriminative ability in order to determine clinician diagnosis. The negative predictive value was especially high when G-probabilities were less than 5%, whereas positive predictive value was modest where G-probabilities were greater than 50%. In conclusion, we found that genetic data could be harnessed in the outpatient clinic with tools such as G-PROB. In future, genetic data may complement serology and clinical data in order to improve diagnosis in the modern rheumatology clinic.